Welcome to Qiological Shop Talk. In this podcast, we bring you roughly 20 to 25 minutes of practical clinical methods, perspectives, and advice that has its work boots on. Listen in for clinical gems that you can begin to investigate the next time that you walk into clinic. Additionally, visit the show notes page for supporting materials from this week's guest on Shop Talk. All right, friends, roll up your sleeves. Let's get to work. This episode of Shop Talk is brought to you by LASA OMS, your clinic's partner in wellness. Later in the show, listen for a special offer from LASA to help you with all the transitions your patients face. The information shared on this podcast is for educational purposes only and is not intended as medical advice. Always consult a qualified licensed healthcare professional before making any decisions about your health or treatment. The host and guests are not responsible for any actions taken based on the content of this podcast.
Hello, this is Kristin Wisgirda in Massachusetts with a Saam case study from my practice. I've been practicing Saam acupuncture since Toby Daly started teaching it, and I'm now teaching in this tradition. I hope this case will inspire more acupuncturists to study Saam, while I also hope that it will be interest for those who are already practicing Saam. In 2019, a patient came to me for a return visit. She was jubilant because she had been discharged from the wound care clinic she had been attending twice weekly for over 2 months. The wound had resulted from a fall 2 months prior when she scraped her left shin. 2 weeks before her jubilant visit, she came to see me complaining of fatigue and wooziness in her head. And oh yeah, she also had this giant wound on her leg. It was all wrapped up during that visit, but she showed me a picture that had been taken the day before. The overall wound was 8 inches long and 3 inches wide. It had kind of a purpley bruised look with some redness on the periphery. In the center was a 4-inch by 1-inch area of exposed, moist granular tissue that hadn't epithelialized. I treated her with Saam-style acupuncture that day. When she went back to the wound care clinic 40 hours after acupuncture, so less than 2 full days, the open area of the wound had fully closed over. The clinic had been preparing to use placenta tissue on her wound as a last-ditch treatment because the standard treatment just wasn't helping. Now they had no need to do any treatments, and instead they discharged her. The doctors and the nurses all commented that they had never seen such a big change in a wound in 3 days, but that it couldn't possibly be from acupuncture. My patient is convinced that they are wrong. And me too, since I've seen acupuncture, especially Saam-style acupuncture, produce very dramatic treatment results very quickly. Saam is a Korean monastic tradition of acupuncture, and it's organized around the 12 primary channel systems. These channel systems include the channels and their respective organs. The 12 channels are described as carrying particular elemental qualities in a way that synthesizes their yin-yang, 5-phase, and 6 conformation qualities. Particular relationships among the channel systems, outside of the way they're usually organized in yin-yang, 5-phase, and 6 conformations. So these particular relationships are seen as being crucial for health, but also the cause of pathology. These relationships are one of counterbalancing. So these 12 channels are broken up into 6 channel pairs. So for instance, in this one counterbalancing relationship is between the heart and the urinary bladder. The heart is yin double fire, as it's of the water phase in Shaoyin fire. And this double fire is seen to counterbalance double cold water, because urinary bladder is yang double cold, it being of the cold water phase and of Tai-yang cold. The other 5 channel pairs are gallbladder paired with pericardium, liver paired with sanjiao, kidney paired with small intestine, lung paired with stomach, and spleen paired with large intestine. What I love about this style of practice is that it demands that you have an intimate relationship with elemental qualities and directional movements, dampness and dryness, hot and cold, consolidation and dynamic movement, up and down, dark and light, internal and external. You have to know how to recognize the way that all of these play out in the dynamic complexity of a living system. Because with each Saam treatment, you are using 4-point needle technique to strongly add these qualities when they are deficient. The power of the system means that when you diagnose and treat correctly, results can be amazing, as with my patient. But the other side of the coin is that incorrect diagnosis and treatment can lead to adverse events. What I also love about Saam is that it's strongly observation-based. We look at skin quality and coloration and markings. We look at people's hair and their symmetry and their eyes and their hands and their heels and their posture and their body shape and size, the quality of the flesh. We look at their socioeconomic status, and we also look at their sex appeal. So everything's a potential pointer to the channel imbalances, creating health or creating pathology. The observational nature of Saam has me deeply appreciating humanity in a new way. It's required that I check my judgments at the door and really try to see these elemental qualities in my patients. Like, none of these qualities are good or bad. There's just too much or too little of certain qualities, and all of these qualities are essential to life. Toby Daly often describes Saam as love medicine. I can attest to this and tell you that this practice has enriched my life by really enhancing this appreciation of humanity. So back to my patient. How did I help her that day? The first clue is that her wound was squarely on the stomach channel. In Saam, channel location means that we must look at the state of that channel system, in this case stomach, and the state of its counterbalancer, in this case, the lung. So even though we often treat channel pairs other than those where the problem manifests, we look beyond the channel location when qualities other than the channel are the more prominent part of the picture. For this situation, both the channel and the quality of the problem and the overall condition of the patient told me that the counterbalancing pair that included the stomach was the problem area. So in this case, we need to look at both stomach, the channel and the quality, and lung, the channel and the quality. So lung is yin. It's dry metal, and tai yin, dampness. So it has the combined qualities of metal dryness and tai yin dampness. These manifest as a dry exterior and a damp interior, but also a capacity to gather qi and resources and create a firm inflation through the body, like a balloon that has plenty of air to fill it out, so the surface is firm and the balloon is buoyant. When the lung is excess, the skin is too dry and the body is too fat and kind of too overfull, like an overinflated balloon. The voice can be loud because there's such an accumulation of qi that just kind of comes out. The patient has an overabundance of qi and dampness that often creates symptoms of stagnation. Stomach, on the other hand, is yang, earth dampness, and yang ming dryness. So the damp and the dry are in different locations and belong to different aspects compared to the lung. So when stomach is in excess in relationship to the lung qualities, the patient presents with a damp exterior and a dry interior, and a tendency to not accumulate dampness in qi in the interior. So we could say kind of an interior deficiency or a lack of ability to hold on to resources. Besides having moist or sweaty skin, that dampness on the exterior, in less than normal amount of body flesh, kind of a skinnier presentation, Stomach excess patients will have soft voices. The balloon of the body is deflated and lacks the chi and resources to fill out all the way to the surface. So in Saam, there's a saying, sometimes channel and sometimes quality. We already know that the stomach channel is where the problem is manifesting. Let's look at how the quality of the problem area and the qualities of the patient present as an imbalance of the lung and stomach channel pair. So my patient with this wound was 73 at the time. She was about 20 pounds overweight with thin and fragile skin that was extremely dry and flaky. Her surface was also remarkable for a thin layer of fluid just under the skin throughout her body and extensive purpura. Her legs were also mildly edematous on top of this extra fluid under her skin. And her legs were also full of very fine varicosities. They often felt achy and sore to her. For all of this extra fluid and weight, the balloon of her body seemed more deflated than overinflated. So more stomach quality than lung quality. Her thenar eminences were also deflated, but her chest wall was of normal size. The chest and thenar eminences are important areas for evaluating the state of the lung. Her voice was soft and weak, and her abdomen was soft and squishy. She was very chatty, but kind of caught up in her own to-do list and other people's problems. She wasn't especially hot or cold. Her chief complaint had been tiredness, but not the wound. She has to limit fats, otherwise she'll have diarrhea. She's an accountant who was still working 20 to 25 hours a week, and she was attending exercise classes several times a week and also tending to her ill sister, which was a big expenditure of energy for her. By nature, she's a big pushover who continues to see clients who annoy and exhaust her, even though she would be well off without the extra money. She felt better with 9 hours of sleep, but would only get 8. Other complaints during that visit included wooziness in her forehead, kind of an off-balance feeling that she denies needing to stabilize herself and sit down. So here's a simplified analysis of her symptoms according to Saam. And I'm only highlighting the aspects of her presentation that for me had the most clinical weight for her situation at the time. And we really need to, the grossest thing in the room was this wound. So we really needed to focus on the dynamics that were creating the wound. So the presence of the stomach channel gives weight to both lung and stomach involvement. So that has equal weight for both lung and stomach. Even though the problem is on the stomach channel, we give lung as much attention as the stomach in Saam. Lung energy manifests, again, with dry skin and extra body weight and good resources. And she had all of these aspects. So remember, lung is dry metal on the surface and damp tie-in on the interior with an ability to accumulate chi and resources. So she had plenty of exterior wealth. She had plenty of money and was very comfortable financially. So a snapshot might have had us thinking that the lung could be in excess here, but we have to look at the state of her stomach energy to see the balance between the two. So for her stomach energy manifested as dampness on the exterior, showing up with the moist, open wound. So because of the dramatic presentation with this wound, we give it the most clinical weight. Like, this is the problem right here. We can't get distracted by other things. Other manifestations of her stomach energy are her soft voice and her deflated body and thenars. Weighing the balance of lung and stomach qualities, the stomach qualities for her are more dominant. So we can see that the imbalance is of stomach excess and a relative lung deficiency. So the magic treatment that healed her wound was supplementing this relatively deficient lung to counterbalance the excess stomach energy. Lung bringing dryness to the exterior and resources to the interior. The resources that lung brings to the interior are moisture, but more importantly for this case, qi. Supplementing lung blew up her deflated balloon so that qi could get all the way to the surface, bringing everything her body needed to heal that wound lightning fast. The fluid under her skin could be considered either interior or exterior. In this case, I choose to think of it as exterior. Her low energy could also come from lung or stomach excesses. Too much stagnant qi or not enough qi. Too much stagnant qi is qi bound up and not available to the system. And then deficient qi is also obviously qi not available to the system. In this case, other signs pointed to a stomach excess, internal emptiness, rather than a stagnant lung excess. Not only did her wound heal, she also reported a big lift in her energy after this treatment. And I still see her every month or two for a variety of conditions or just a tune-up. If you're interested in learning more about Saam, I highly recommended the resources here on Qiological, especially the Introduction to Saam taught by Toby Daly. Toby's class provides you with the foundation needed to practice Saam. Saam seems simple, but it really is very sophisticated. Its strong power must be used with great caution. Don't try this at home until you have taken Toby's class. Qiological also has other free and paid classes on Saam taught by Toby Daly, and I recommend all of them. As Toby's teaching assistant, my offerings include a very active subscription Saam mentorship forum on the White Pine Circle. I also taught an eye observation class that is Saam specific, and this is available on demand on Qiological. My latest course on Qiological is the upcoming 12 Channels of Saam, which will begin in April 2023. The prerequisite for this class is Toby's intro class. This 12 Channels class takes the information from Toby's intro class and provides a deeper dive into these foundational materials. So we delve into how to better identify the most essential elements of the channels. Learning to assign clinical weight is key to correct diagnosis and also makes the process so much easier. This will be a very clinically oriented class. A private forum will keep the conversation going between classes, and it's also a place to ask questions, even if you can't make the class live. Please look to the show notes for more information for all of these resources. I hope you will join me.
When you're looking for herbs, tools, and supplies to guide your patients through life's transitions, you need quality you can trust. Lhasa OMS offers an unmatched selection of acupuncture needles for every style, herbs from all your favorite manufacturers, and everything else you need to run your clinic with confidence. Visit LhasaOMS.com to source the herbs and other supplies featured in this series. Use the code FERTILE15 for 15% off your next purchase at LhasaOMS.com. Some exclusions apply. See website for details. That's it for this episode of Shop Talk. Did you learn something that brought a patient to mind? Don't keep a good thing to yourself. Share it with a friend. They'll be happy that you did. And tune in again for our next episode of Shop Talk.